Hello, my name is Teresa Hallinan. I'm an occupational therapist and certified hand therapist. Today I'd like to share my experiences as a mentor, what I've learned, how I've grown, and what I hope to pass along to the next generation of clinicians. In addition to my clinical care, I serve as co-director of a hand therapy fellowship program, an instructor in an occupational therapy doctorate program, clinical educator, vice chair of the ASHT Leadership Committee, and co-chair of the ASHT Leadership Development Program. Needless to say, I love all things hand therapy, and I love to support other hand therapists. When I reflect on my early days in hand therapy, I remember how complex and intimidating the field felt. Anatomy, protocols, orthotics. It was a lot. I was fortunate to learn from generous and highly skilled mentors who imparted both their expertise and confidence in me. And if I could thank them every day, I would. That experience ignited in me a deep commitment to mentor. It's what drives my work in the fellowship program and in the classroom, helping novice and new therapists transform uncertainty into capability. As a mentor, I meet each learner where they are, whether I'm supporting a doctoral student during fieldwork, guiding a fellow through a challenging nerve transfer protocol, or walking a novice therapist through their first national conference abstract. I strive to create a safe, collaborative space where growth is not only possible, it's expected. In my role as co-director of the Hand Therapy Fellowship, I help clinicians develop advanced skills in clinical reasoning, collaborating with surgeons, and integrating evidence-based treatment planning. As an instructor, I teach learners to integrate both theory and practice to prepare for complex clinical realities. But mentorship goes beyond teaching techniques. It's about modeling ethical, decision-making, patient-centered care with professional humility and resilience. It's about asking the right questions, but not always having all the right answers, but knowing where to find them. Mentorship has sometimes been challenging. Finding solutions, helping mentees overcome obstacles, and juggling patient care with leadership roles is sometimes difficult. But those moments continue to push me. They push me to listen more carefully, learn more deeply, and reflect more intentionally. Mentorship is a two-way street. It includes curiosity, vulnerability, and embracing new challenges. These are all lessons learned from all the students, fellows, and new therapists I've collaborated with. Some of the most rewarding moments have come when watching learners, mentees take bold steps, successfully fabricating a difficult orthosis, advocating for a patient, and presenting their first poster or instructional session at a national conference. Encouraging students and novice therapists to take the leap into scholarship has become one of my favorite parts of being a mentor, when they see themselves as contributors to the profession, not just consumers of knowledge, and it changes everything. It ignites a fire in them, and I really love seeing that. Mentorship to me is both a responsibility and a privilege. In hand therapy, where clinical complexity meets the human experience, mentorship ensures continuity, excellence, and overall heart. To all seasoned clinicians, I hope that you can make space for growth in a mentor capacity. And to students and novice therapists, be brave. Say yes to the opportunities that scare you a little. They're often the ones that shape your future. I know they've shaped mine. Always reflect on what went well and were there any opportunities for growth. This introspection is often what makes therapists stand out. Thanks and happy mentoring.